Last year, we began this process of legacy collaborating with Mount Sinai International. And the intention was to see that our Ramaya Memorial Hall sets up a number of centers of excellence in various super specialties with the help of a very well-known, highly reputed healthcare system of the Mount Sinai International in New York. We have entered into a 10 years long collaboration with their system, which began on the 1st of July, and we are formally launching the collaboration today. Involves setting up centers of excellence in various super specialties in our hospital, including cardiology, oncology, nephrourology, neurosciences, gastroenteritis. Mount Sinai International will help us in maintaining patient safety standards and quality of service throughout the period of collaboration for all the specialties in our Ramaya Memorial Hospital. This is in addition, they are helping us in the selected super specialties for setting up clinical practice protocols along with our clinicians in the Ramaya Memorial Hospital. As you probably know already, Mount Sinai International, Mount Sinai Healthcare System is a very large establishment in New York. They have 8 large hospitals in New York, employing over 7,000 clinicians on their establishment, and they have virtually all the specialties for clinical care. They have a history of over 150 years of providing health care, having been established as a hospital in 1882. Dr. Dorsams will brief you about the history of their institution and their perspective on the collaboration.
But with all of you, I would like to start with stating that our leadership at Mount Sinai Health System of New York is very proud and honored to be in Ramaya, because Ramaya and Mount Sinai shares common mission of finding ways to best serve our patients, provide better quality care, and strive for the best outcomes. In that quest, we forged a relationship to establish and help improve healthcare processes, clinical care processes in multiple specialties, including cardiovascular care, oncology, and other areas. Our history in New York City is exactly that. We are not only a major healthcare provider in the city, but we are one of the top academic medical centers in New York, in the United States, and in the world. We are providing medical education. We are also doing medical research in virtually all disciplines. And we are in the forefront of innovation, not only in specialty care, but also in quality and patient safety. In that spirit, we are going to work together with Ramaya and our colleagues at Ramaya and help them reach higher level care here as well in Bangalore.
M.R.Jayaram, President Swami, and all the people who welcomed us so warmly here, technology capital of India, and to be in this medical center, which has shown us a true dedication to patient care and absolute alignment of missions, is something which is really remarkable. Not only does Mount Sinai have something to offer in terms of helping bring some specialties to the next level, Ramaya has much to offer us as well. The diversity of the population, the very large nature of the services provided here, the high level of quality that exists, the exposure to patients and problems that don't exist in New York, And the remarkable things that we've seen, such as the tissue banking here in Bengaluru at Ramaya, are things that will cause information and knowledge to flow in both directions. So we are delighted to be here today. We're delighted to begin this partnership. And I know that if we're only talking about the first 10 years of our relationship, I'm sure it's something that will go on for a long time, because when you build friendships like this and partnerships and you train one another, you develop lifelong bonds, and it leads to generations of better care. And we all are here to do what we intend to do, which is to improve healthcare, both in India and in the US. Thank you.
To all. This is took us about 1 year to get to here after the first meeting back in New York, and I'm very glad that Mount Sinai actually is the first affiliation of Mount Sinai with any medical center in India. So very proud of it. From Jaipur, and I've been working Mount Sinai since 1988. So to see this collaboration, so just to simple terms, of course, besides the quality which will improve, is the both technology and skill improvement. Skills, what does it mean? Any technology, many equipment, many machines which are available outside and now they're available here in India. Which one to get? What is the best one? Knowing that we have used them, we'll give the right advice. And the second is, you have the machine, but you need the skilled people. So skill, I would say, is the equally important of this affiliation, which will be both ways. One, most important, that experts from here visit Mount Sinai and get trained on those technologies. So done what is advanced, they're fine, so they get educated to it. So therefore, their thinking process, they're the future of our science, of medicine. So they will have that scope. So combination of these two is best for particularly our Bangalore and Indian public and patients get the best treatment. That is ultimate the goal of this affiliate.
What it will benefit, what it will gain. I'm sure this is a new process where we are trying to merge rich cultures, especially the India practicing affordability and accessibility as a challenge, and there is a resourceful Mount Sinai. They have got quite a few things to know how we manage, but we have a large amount of things to learn from them on patient safety and quality. And as you know, across the world, any institution which caters to academic, patient care and research are found to be the leaders in the healthcare. So when you consider these three tenets of the best of institution, whether you call whatever it is in across the world, you need to have all the three branches: academic, curative, and research. To that, we both have the similar understanding, and to run ethically a very standard care with the patient safety and the quality being the forefront. And luckily, without research and newer things can happen, nothing will move forward in health. That I'm finding for the population of the country, which will be a game changer. I know that all that happens in New York cannot be transported, copy and paste on. What happens there best, we need to customize it to our situation, which they are willing to help us to develop, seeing our thing. The beauty is their people will come here and see in real what is the Indian situation. But leave alone, Dr. Sharma is an Indian and he knows our systems very well, and he has been the star cardiologist over there and he will help the cardiology. Similarly, we have Ash Tiwari, who is a leading uro-oncologist there, who will be leading the oncology driving here. So we are going to get the best of the brains to sit together and work for the patient safety and the patient care. That's the purpose of this. And the biggest beneficiaries are the doctors on both sides and the medical students.
And regional approaches. So there are things where now Karnataka has been present. So we would like to present And if people are going to other places, yes, don't go.
Between Ramaya Memorial Hospital, Bengaluru, with the Mount Sinai Hospital, New York, USA. Hear the energies of the doctors. So please put your hands together for all the dignitaries on the dais. Of the land signifies important strategic collaboration.
Food and renewable energy, respected Shri Prahlad Joshi ji, Honorable Minister for Health and Family Welfare of Government of Karnataka, Shri Dinesh Mundu Rao ji,
The Mount Sinai Hospital, New York, coming together. I would like to pause here briefly, reflect the past, the present, and the future. This institution was started in the year 1960 by my beloved father. He established the Gokula Education Foundation. We have celebrated the Golden Jubilee, Diamond Jubilee, very recently. The first institution was the Ramaya Institute of Technology. Then the number of institutions started, and most important milestones were the medical college was started in 1979. The Ramaya Teaching Hospital was started in the year 1984.